So when you think about the things we want to do with generative AI in healthcare, AI is trained on data, it's prompted with data. And so it's very, very dependent upon the quality of that data to make good decisions. And that's not just an AI thing. That's all things. People rely on good data to make good decisions. Old school analytics, like back when I was a boy, digital quality measures and AI, all of those things require quality data. Now, with AI, the big difference is the scale of what we're talking about. In the old days, we could get by with low quality data because a human could intervene in time. But as we scale the rollout of some of these generative solutions, it's going to be happening too fast. So we have to ensure the quality of the data is right so that we don't make tragic mistakes. So the PICI framework, the Patient Information Quality Improvement Framework, was an idea I had about 2 years ago when I was doing a presentation of all things. And it since has evolved into a way where we as an industry can start objectively measuring the quality of the data in a way that we can check each other and we can make sure that not only is the data good, but if the data is not good, we can explain why it's not good so that we can fix it. Because if we're going to be in this community where we're sharing data with the goal of improving patient care, we've all got to kind of do our part to make sure the data that we're sharing is good and usable by the other folks in the community. So the Pixel Gateway is our commercial scalable implementation of the PICI framework. And the idea is for our clients, whether they're payers, providers, or in life sciences, when they're accepting data or they're expected to accept data from someone else, it allows them to assess the data against their use case, determine if it's usable. And once it is, they can let it in the door. And until it is, they can give the feedback that your data is not really good enough for what I'm trying to do. And here's how you can fix it. It's really all about, like Lord Kelvin said, if you can measure something and explain it in numbers, you know something about it. But if you can't, then you're only kind of thinking about it as an idea. It's time that we in healthcare started measuring and understanding what we're actually trying to exchange. And that's what the idea of the Pixel Gateway is all about. I mean, the interesting thing that's happening right now, coming up on the CSM Quality Conference, is what just happened at the ASTP annual conference. And that is that there's really a lot of emphasis put on how we're sharing data. So it's less about the EMRs themselves and more about our ability to take data and use it, and also make sure that people are not doing information blocking. Now, my personal feeling is if you're sharing bad quality data, that's information blocking. Whether you don't give it to me or you give it to me in a form that I can't use, you're not really sharing the data with me. And there's a lot of emphasis being put on FHIR, on APIs, on our ability to exchange and leverage that data. Because I think one of the things CMS is really trying to do right now is they really want to be able to take tools like AI and use it to make sure that the money we're spending in CMS is being used for the people that need it and not some kind of fraud and abuse scam. There was actually a great fireside chat where Amy Gleason and Tom Keene sat down and talked about kind of how they're collaborating to improve how we exchange data, how we make the data usable. And when you think about what's coming out in HTI-5 and what could come out in HTI-6, a lot of it is about enablement, sharing, FHIR, and to reduce information blocking. I like that because data quality, poor data quality is really information blocking, for lack of a better description. And I think the other thing that CMS is really trying to do by allowing it to be easier for us to share data, it's going to enable their ability to use AI and other tools to look for fraud and abuse and make sure that the money we're spending as a nation on CMS is going towards the people that need it and not going towards some scam.